The psychological approach in rehab rests on 4 pillars.
Right. Education for the patient, setting clear goals, using mental training techniques, and leveraging social support.
Before getting a peek into the ebook, The Psychology of Sport Injury by a friend, Dr. John Heil, allow us an opportunity to amplify a snip from another podcast. You'll want to check out the podcast called The Ready Room. It is on YouTube. See CBC Sports, the voice of Canadian athletes, fans, and the Olympic Games. The host is Brittany McLean Campbell. Here she talks with Summer McIntosh.
What excites you most about this next chapter in Texas? I would say there's unknowns, but there's a lot of knowns as well. I know I can fully trust Bob and trust his training, and I know I'm going into an amazing training group, but I also think there's unknowns when it comes to what that's going to do with my racing and my potential, and I think kind of the sky's the limit with him, and I know he's going to make me reach my full capacity and potential, so that's really, really exciting. So I think that's more the unknowns, and how fast I can really go is what I mean when I say unknowns, but I know that no matter what, I'm going to have an amazing setup there, and I'm so excited to move to Austin because it's a really cool city as well. So yeah, I'm really excited for this new chapter, and it's kind of like I'm growing up in a way and kind of starting a fresh page for sure.
Yeah, there's going to be great food, great music, great swimming, great culture. Do you have any intention on going to school, or is that going to be maybe a decision you make down the line?
Yes, that's more of a down the line decision. The first year I really just want to get settled there because it has been a lot this past year, a lot of different changes, things like that, but definitely I'm going to go to university. I don't know if it could be at the University of Texas or it could be an online situation. I'm not exactly sure yet, but definitely doing university after probably the first year, I would say.
Good luck to summer, and may we all have wonderful summers. Our next topic features great, detailed, important issues that everyone faces eventually. Pain, injury, hurt, emotions, and it all comes together in an ebook in the ISCA online store. Bumps and bruises come fast and unexpectedly. You may wish to get this ebook yourself, or get it for a friend dealing with some blended issues, physically and mentally.
The book author is Dr. John Heil.
When we talk about sport injury, our minds usually jump straight to the physical stuff, right?
Totally. The torn ACL, the stress fracture, all the recovery exercises. That's what we see first.
But what if the truly crucial part, maybe the most challenging part of getting hurt, isn't just the physical damage?
Look, the physical trauma is undeniable, obviously, but anyone who's gone through a serious injury knows it's a massive mental and emotional thing, too. So just focusing on, tissue repair, you're missing a huge piece of the puzzle.
And that's exactly what we're getting into today. The psychology of sport injury, kind of peeling back the layers, trying to understand that mental side of getting hurt, navigating that recovery, which is often long and uncertain.
Yeah, and sometimes, having to adjust to a whole different future than you planned.
So we're drawing from a really comprehensive body of work for this. It blends insights from sports psychology, behavioral medicine, and traditional sports medicine.
It gives us a great lens, a powerful way to see injury not just as a physical event, but as this complex mind-body challenge.
So our mission here is basically to get to the heart of those key psychological hurdles. Hurdles faced by athletes, sure, but really anyone whose performance relies on their physical and mental edge.
And we'll explore how the people around them, their support system, are just critical.
And uncover some surprising ways mental skills aren't just for peak performance. They're fundamental tools for actual healing and recovery.
It's like giving you a shortcut to understanding this vital, often kind of overlooked intersection.
So the core idea is pretty simple, but profound.
You just can't effectively treat the physical trauma of injury in isolation. You just can't. Successful treatment has to address the psychological side right alongside the physical repair. They're completely intertwined.
There's a great story, actually, that illustrates this from Dr. John Heil. He talks about his own time back when he was an athlete in the training room, and he describes it as this incredible place for both healing and learning. He remembers a specific teammate, Roger,
right.
Even after his physical treatment was technically done, Roger would still come in, just sit there for a bit.
And he'd leave feeling better, apparently, even without any hands-on therapy that day. That little story, it says so much, doesn't it?
It really does.
It shows that, intangible power of the environment, the relationships with the staff, Jim Matthews, who Dr. Heil mentions, was so influential.
Yeah.
And Dr. Heil says, seeing that firsthand, that's where his own career path in psychology kind of clicked into place. He realized the training room wasn't just for fixing bodies, it was for healing the whole person, mind and body.
And look, this perspective isn't just for traditional athletes in helmets and pads.
No, not at all. The insights apply way more broadly. Anyone whose performance needs that physical and mental skill.
Like performing artists.
Mm-hmm.
Dancers, maybe? They're often called artistic athletes.
Or musicians even. It really expands the idea of sports medicine. It could almost be medicine for the arts.
What's fascinating there, I think, is how that pursuit of excellence just sets a totally different standard for what normal means physically and mentally.
Something that might be, within normal limits for just daily life. That could be absolutely critical in a high-demand performance setting.
Even subtle things like a bit of lingering pain or a flicker of fear.
Huge impact. It can dramatically affect someone's ability to perform at their absolute peak. And that's quite different from traditional medicine, which often looks for big deviations from the norm, like diagnosing a disease.
So this understanding that athletes and performers have these unique needs, it really drove the emergence of fields like sports medicine and sports psychology.
Which really started gaining traction back in the, late 1960s.
Yeah, around then. And this work really underscores that sports medicine has to be multi-specialty, right? Team-based.
Oh, absolutely. You've usually got the physician, then a specialist, like a physical therapist or an athletic trainer.
And crucially,
Yeah, a sports psychologist or maybe a clinical psychologist is often part of that core team.
and the critical thing to get is that everyone on that team, from the doctor prescribing meds to the trainer doing exercises, all have a psychological impact on the athlete. Psychological recovery isn't some add-on.
No, it's essential. It's absolutely essential for rehab to work effectively. And that coordinated care where everyone's talking and working together, it's non-negotiable if you want the best outcomes.
Okay, so let's zero in a bit on the athlete's actual experience with injury.
Because for many athletes, injury is, unfortunately, almost an everyday problem in sport. Athletes are just wired to compete. That intense motivation often pushes them to work through discomfort, sometimes even when they probably shouldn't.
And that internal drive, it gets amplified by all the external stuff.
Think about it. Teammates might be vying for your spot. Coaches need you out there.
The medical team is managing expectations and timelines.
And if you're in a high-profile sport, the media's watching. A negative story about a slow recovery, that can feel like a real cruel blow on top of everything else.
And pain itself is it's incredibly complex for athletes, isn't it?
Totally nuanced. They constantly have to figure out, is this performance pain, the good hurt from pushing limits, or is it actual injury pain?
And then, is it benign pain or is it something harmful?
And the fact that athletes often have these remarkable feats of pain tolerance,
That actually makes it harder, right?
it makes it harder and more critical to get that differentiation right.
So then, deciding when someone's actually ready to go back, it's rarely black and white.
Definitely not. It's often this gray area. Ideally, you want the athlete, the coach, and the physician all on the same page about readiness. But yeah, the athlete almost always wants back in sooner. The physician's focused on safety, the coach is balancing team needs, and the individual getting all three aligned.
That's the key.
It's essential, and they all really need to agree for the best and safest return to play.
And then there's the really tough one. Career termination, especially when it's forced by an injury.
Oh, that's huge, a massive life transition. Athletes in that situation need serious support to adjust.
To a whole new identity, potentially.
Yeah, and lifestyle. Counseling can be absolutely vital there, helping them see and transfer those incredible skills they developed. Concentration, goal setting, discipline, teamwork.
Transfer them to other parts of life.
And importantly, stresses keeping up physical activity even after retirement. It's crucial for overall well-being.
Okay, so moving beyond just the injury event itself, this work highlights how psychological factors can actually play a part before anything even happens. They can increase the risk.
Yeah, that's a really key insight. It suggests injuries aren't always just like random accidents.
Right. They can be the end result of things like losing focus for a split second or intense pressure or just being physically exhausted.
There's a well-established stress model here. It shows that psychological factors do influence injury risk. Athletes dealing with high levels of life stress, and that's both general life stuff and sport-specific stress, they're shown to be like 2 to 5 times more likely to get injured.
2 to 5 times.
Yeah, especially if they don't have good social support or strong coping skills.
And the stress response itself, that causes changes too.
Oh, yeah, a whole cascade. Cognitively, you might shift from seeing a situation as a challenge to feeling, dread or anxiety.
Physically?
Physiologically, you get increased arousal, more muscle tension, and changes in attention, like being more easily distracted.
There's that concept, peripheral narrowing.
Under high stress, your focus can kind of tunnel in right on what's directly in front of you,
So you miss things on the sides.
which could definitely increase your risk of, say, getting hit or making a mistake.
It's overtraining syndrome.
Which, okay, there isn't one single definition everyone agrees on, but it's clearly linked to pushing too hard, heavy training loads without enough recovery time. Monotony in training can contribute too.
And diagnosing it isn't straightforward.
No, you have to rule out other medical issues first. And really importantly, monitoring athletes for overtraining needs to be individual. You track their changes over time, not just compare them to some group average.
So the psychological impact isn't just after the injury. It's before, during, and after.
Precisely. You've got pre-injury factors, things like past medical or psychological history,
Yeah.
somatization.
That's when psychological distress shows up as physical symptoms.
Yeah, you see it more often maybe in younger athletes or ones who feel pressured to participate. Then there's life stress, overtraining, the pressure cooker before a big competition.
Even being a marginal player fighting for your spot.
That adds stress, absolutely. And things like drug use or eating disorders, they also fall into this pre-injury category and definitely affect how someone copes if they get injured later.
Okay, then at the time of injury,
There's often that immediate psychological trauma, the shock, the feeling of loss, grief, and that sudden scary threat to their future, their identity.
and then following the injury.
Well, chronicity, the longer it goes on, the recovery takes, that tends to make the psychological problems worse.
So what helps recovery?
Key things are how much progress they're making physically in rehab, their overall psychological state, and crucially, how their significant others, their support system, respond.
Score it again.
Always comes back to support. And the source even mentions that unique frustration when injuries happen totally outside of sport, like a top skier breaking a leg just slipping on some ice.
Oh, man. Yeah, that's got to be tough. So given how linked the mind and body are here, assessing the psychological side is just as vital as checking the ligaments.
It really is. And it needs to be comprehensive. You pull info from lots of places, the doctor, the PT or trainer, the coach, parents.
Even media sometimes.
In high-profile cases, yeah, understanding that reaction can be part of the picture. You're trying to balance the objective facts of the injury with the athlete's own subjective experience of it all.
What kinds of tools do they use for that?
Well, simple things like visual analog pain scales are common. A pain drawing where they mark where it hurts can sometimes show patterns suggesting somatization.
Standard psych tests, too.
Yeah, things like the MMPI. Interestingly, studies have shown links between general psychological health and performance. More specific tools, like the MBHI, a health inventory, can even help predict how an athlete might relate to their providers or stick with the treatment plan.
Oh, interesting.
Yeah, like high somatic anxiety often correlates with poor compliance, unfortunately. A pain activity diary is great and helps the provider understand, but it also really increases the athlete's own awareness of their pain patterns and triggers.
And when you give feedback from these assessments,
The advice is, be cautious, be clear, be balanced, don't hit them with jargon, pick a few key points, acknowledge strengths and concerns, and frame it constructively, like how they might react in rehab.
okay, so all this assessment feeds into intervention, and that team approach is key again.
Absolutely crucial. How quickly and intensely you intervene psychologically depends on, how much distress the athlete is in and how committed they are to getting back.
So a minor sprain might not need formal psych help.
Not necessarily, unless other issues pop up, like maybe they keep getting injured or they develop a real fear of re-injury.
Age matters too, right? Developmental stage.
Big time. With kids, parents are obviously heavily involved. With adolescents, it's that tricky balance, confidentiality, letting them have a say, but keeping parents in the loop appropriately.
And for young adults, pros maybe.
Yeah, then you're often dealing with career implications, maybe that potential loss of identity if retirement is on the table. Those are huge issues.
What about chronic pain? That sounds like a whole different level.
It really is. It needs a much deeper, more comprehensive assessment. Because with chronic pain, the pain itself gets tangled up with thoughts, emotions, environmental cues.
And the suffering changes behavior.
Profoundly. So the standard approach is multidisciplinary. Medicine, psychology, PT, OT, nursing, all working together.
And that coordination pays off.
Big time. Synergistic effects, multiple treatments targeting something like muscle guarding work way better together than in isolation. And we have to acknowledge chronic pain can have devastating outcomes, and it affects tons of recreational athletes too, not just elites.
Which leads us back to support. It keeps coming up. This work really hammers home that social support is vital.
It's a buffer against stress, and it significantly boosts recovery.
But sadly, injured athletes often feel cut off from their team, right when they need that support most.
Exactly, they lose that connection. The source actually breaks down social support into 6 different types.
What are they?
Okay, there's just plain listening. Then, technical appreciation, like acknowledging skill. Technical challenge, pushing them constructively. Emotional support. Emotional challenge, which means being honest even when it's tough. And shared social reality, connecting over similar experiences.
And different people provide different kinds.
That's the idea. Teammates and coaches, often strong on the technical stuff and shared reality, maybe less so on the emotional support, just due to roles or competitiveness.
Medical team.
Both technical and emotional. Family and friends, usually huge sources of emotional support. So understanding these different parts of the support system, the team, the medical staff, personal connections is really key for everyone involved.
Okay, so understanding the psych factors, the support systems. This connects directly to mental training, doesn't it?
The source argues these skills are crucial, not just for performing well, but for actually managing the injury process itself.
Like what kind of techniques?
Well, relaxation is fundamental. Imagery or mental rehearsal is incredibly powerful. You can do mastery rehearsal, visualizing success, a perfect return, or coping rehearsal, mentally practicing how you'll use your skills to overcome challenges in rehab or when you get back to playing.
There's even healing imagery.
Yeah, healing or healed imagery can be very concrete, like visualizing ligaments getting strong, like steel and rubber, or a repaired meniscus being smooth, like Teflon.
Wow. Biofeedback, too.
Yeah, using things like EMG to monitor muscle activity. It can help with relaxation, muscle re-education, learning to discriminate between tension and relaxation.
And controlling pain.
Strategies there include things like focusing externally, maybe on music or using pleasant imagery. The source also mentions pain dissociation or sport dissociation.
What's that?
Kind of mentally detaching from the pain. It can be useful sometimes, but there's a caution.
Which is?
Overusing it during performance can actually backfire, hinder performance, maybe even increase re-injury risk. It's probably better used outside competition or during breaks.
Makes sense. And managing fear and anxiety.
Crucial. Techniques like systematic desensitization, stress inoculation training, or cognitive behavioral approaches like the self-control triad, basically. Stop, take a deep breath, picture a positive scene.
All about building coping skills.
Coping skills for attention and arousal control. And sometimes you see real traumatic conditioning like a phobic response.
Like the example of the diver.
Yeah, the diver developing a fear of the board after hitting it badly. And intrusive thinking like catastrophizing, constantly replaying the injury. That can be a real battle too.
And rehab itself, that brings its own challenges.
For sure. A common one is muscular guarding, tensing up around the injury.
It's protective at first.
Yeah, initially. But if it becomes a habit, it just increases tension and the risk of re-injury down the line.
Compliance is another one, right?
Yeah.
Sticking to the plan.
Yeah, adherence or compliance. Poor adherence is often linked to psychological stuff. High somatic anxiety, low confidence about recovery, lack of support, unclear goals.
But you check practical things first.
Always. Check the simple stuff first, scheduling problems, cost. Do they even understand the exercises? Before you jump to assuming it's deeper psychological issues like trust or adjustment problems.
And then there's the opposite problem. Over-compliant.
Right. The whole no pain, no gain thing, pushed too far, or feeling pressured to rush back. Athletes overdo rehab, risk setbacks, risk re-injury.
And they can sometimes be linked to other issues.
Yeah, it can sometimes tie into compulsive exercise patterns or even eating disorders like anorexia or bulimia, especially in sports where those are unfortunately more common.
Personality conflicts can also get in the way.
Definitely. Clashes between the athlete and providers can really hinder progress. And then those psychological issues we mentioned. Traumatic conditioning, phobias, intrusive thoughts.
The source also flags malingering.
Yeah, basically using injury complaints to get something else, avoid practice, get attention. It's different from genuine psychological struggles needing treatment.
And it sometimes gets tolerated.
Interestingly, yeah, the source notes sometimes it's tolerated in really talented athletes because the team feels they need them.
Which brings us to the really severe end of the spectrum, catastrophic injuries.
Yeah, those require urgent, intensive intervention, obviously.
Just dealing with being hospitalized must be immense.
Oh, yeah. Managing pain, sleep disruption, anxiety about procedures, all the medical equipment, being stuck in, say, a passive movement machine after surgery, the frustration of being so limited.
Mental training can help even then.
Incredibly helpful, yeah, for navigating that whole difficult period.
And a career-ending injury.
Yeah.
That's life-changing.
Profoundly. The loss of identity is huge. Counseling is essential there, helping them grieve, adjust, find ways to transfer those sport skills to a new path.
The source also touches on fatal injury risk.
Which is inherent in some sports, sadly. It highlights the importance of reviewing attitudes towards risk athletes, organizations. It mentions tragic cases, Hank Gathers collapsing on court from a heart condition, possibly pushing limits for glory.
So are fatal accidents like being hit by a puck.
Right. And even public health crises impacting athletes like Magic Johnson or Arthur Ashe with AIDS require specific interventions and prevention within the sport world.
And decisions about competing with known health issues.
Have to be careful, collaborative, physician, organization, athlete, family, all involved in that risk assessment.
Okay, finally, this loops back to show how psychology even touches the biomedical side.
Yeah, it connects the dots. It touches on pain biology, sensory input to the brain, how it's processed, perceived, how that links to suffering.
Gate control theory.
Right, the idea that pain signals can be modulated, like turned up or down in the spinal cord, how neuron sensitization contributes to chronic pain, our body's own painkillers, endorphins.
Muscle tension issues, too.
Yeah, things like myofascial pain, often linked to inactivity or trauma. And fascinatingly, how stress and anxiety can actually reinforce nerve activity, making pain worse that's sympathetically maintained pain.
And medications.
Viewed as tools to be used wisely. Always risk versus benefit. Treating acute pain is different from chronic pain. Getting on top of acute pain quickly prevents complications.
And scheduled dosing is better?
For severe pain, yes. Time-contingent dosing, taking it on schedule, is generally better than waiting until the pain is bad, PRN. It prevents that pain cycle, reduces anxiety, potentially reduces drug seeking.
Belief matters too.
Huge role. The placebo effect demonstrates the power of expectation. It also briefly notes NSAIDs reduce inflammation, acetaminophen doesn't, and mentions risks of anabolic steroids, tendon tears, psychiatric effects, and reiterates the seriousness of eating disorders.
So pulling all these threads together, the big message is the value of that multidisciplinary team.
Addressing both medical and psychological issues, yeah. And optimal management isn't just reacting, it's proactive prevention, early intervention, treatment.
The psychological approach in rehab rests on 4 pillars.
Right. Education for the patient, setting clear goals, using mental training techniques, and leveraging social support. And obviously, severe injuries or persistent psych issues need more specialized help.
And this leads to that really neat idea, the patient-athlete metaphor.
Yeah, I like that. The idea is that all injured patients, not just elites, can benefit from these principles. Recreational athletes are a huge group that could benefit from this integrated approach.
So the psychologist on the team doesn't just do therapy.
No, their role is broader.
Yeah.
Direct services, yes, therapy, training, but also indirect services like coaching the rest of the medical team on their bedside manner.
How to bring in education, goal-setting, support into their everyday interaction.
The whole team problem-solving together. This source provides some really practical injury education guidelines topics the athlete needs to grasp.
Wow.
Understanding the injury, the rehab plan, pain management, meds, limits, mindset, figuring out readiness to return.
And this idea of remarkable recovery. It's not just about the tissues knitting back together.
No, it's built on commitment, hard work, and viewing the recovery process itself as a chance for growth, a self-actualizing learning experience almost.
Which brings us back full circle to sport as a microcosm of life.
Right, because sport involves intense emotion, focused attention, chances for reflection, dealing with adversity. It's a powerful training ground.
So the skills learned there, dealing with setbacks, mental toughness, decision-making.
They can absolutely transfer. They help navigate life's challenges off the field, the ones we all face.
The core takeaway seems really clear. Sport injury is fundamentally a mind-body challenge.
Yeah, demanding an integrated approach. The support system around the person is absolutely vital.
And maybe most compellingly, those psychological skills. They aren't just for performance. They're essential tools for healing, for coping, for building resilience.
And remember, while we've focused on sport, these principles really go way beyond elite athletes. Anyone facing a physical setback that impacts their life, their performance, and whatever they do.
They can benefit from understanding this connection.
Definitely.
Which leaves us with this final thought for you, the listener. If sport really is a microcosm of life, and injury is kind of an inevitable part of both, how can adopting that athlete's mindset, focusing on mental training, setting goals, coping proactively with adversity, really leveraging your support system, how can that help you navigate the injuries, the setbacks, the challenges you encounter, not just on the field, but everywhere else in your life?
Join the International Swim Coaches Association. Subscribe and share this podcast. All prior episodes are available in a course at wafsu.org. See the show notes for more information.